Welcome to this presentation on vitamin D as a therapy. Now you are here simply because you are seeking a real solution, a natural and a holistic solution, a comprehensive solution which can help you manage or alleviate your chronic lifestyle diseases, your chronic pain disorders, or even an autoimmune disease. So let me introduce to you one of the most interesting subjects which is emerging as a new science across the world, called as vitamin D as therapy. Yes, vitamin D, the sunshine vitamin, it is also now being labeled as the miracle molecule in global scientific circles. Okay, you will be able to find thousands of published case studies on international journals about vitamin D as therapy in autoimmune diseases. So let me introduce you to the inventor of this entire system, or a protocol as we call it, Dr. Cesario Coimbra. Dr. Cesario Coimbra was a neurosurgeon based out of Brazil who was working with multiple sclerosis patients. Multiple sclerosis, as you would know, is an autoimmune disease, and Dr. Coimbra found the only real long-term solution, which is what we call as a lifetime management and a remission management for thousands of his patients, was using vitamin D as a therapy instead of immunosuppressants, painkillers and different drugs. Dr. Coimbra found amazingly effective results with vitamin D for his MS patients. I will quote something what Dr. Coimbra directly says, that when we started with vitamin D and found that it was effective, we made a life choice. We left academia behind. These things of drugs here, drugs there, launches of new drugs, testing of new drugs, allegedly satisfactory successes. We put all of this aside and thought only in the interest of the patient who was there at our office in that moment. When we in India started learning this protocol from Dr. Coimbra's team members and we started integrating this is exactly what even we came to experience, and we came to realize that, oh wow, just this beautiful miracle molecule which is nothing but our sunlight, okay, and how it plays a pivotal role in our health. So let me take you into a little bit deeper, because that is exactly what you're here. You're here to seek a real solution for, let's say, your autoimmune disease. So let me tell you that vitamin D and its cofactors as a therapy, or the Coimbra protocol as we call it, works marvelously to be able to manage psoriasis and chronic skin conditions, rheumatoid arthritis, ankylosing spondylitis, irritable bowel syndrome, SLE or lupus, Hashimoto's thyroiditis, fibromyalgia, asthma, allergic rhinitis, diverticulitis, multiple sclerosis, and so many more autoimmune diseases. Now, if the type or the name of the autoimmune disease that you may be suffering is not listed here, please don't be worried. Vitamin D as a therapy will still be able to help you definitely. In which case, you can reach out to us and we will be able to help you further on this subject matter. Now let's look at so many lifestyle ailments. Now, we in India, we know this, that every household has someone or the other suffering these lifestyle diseases, and we go to multiple specialty doctors, we go through expensive testing with no real long-term corrective solutions. Okay, ailments like sleep disorder, snoring, sleep apnea, migraines and cluster headaches, type 1 and type 2 diabetes, dyslipidemia, gut dysbiosis, hyperacidity, thyroid dysfunctions, hypertension, TMJ and TMD disorders. These are all lifestyle diseases, and there are so many more. At the root of it, we've found with so many of these ailments that vitamin D, or one of its cofactors, which we will come to in the future part of our presentation, are at the real root cause. Because fundamentally, if you look at life, if you look at our human body as an organism, it's always a nutritional deficiency at the fundamental root of any chronic ailment. Now let's look at a couple of chronic pain disorders which are treated again marvelously with the help of vitamin D and its cofactors as therapy. Lower back pain, lumbar lordosis, slip disc, herniation, sciatica, cervical spondylosis, radiculopathy, knee joint arthritis or knee joint disorders, Carpal tunnel syndrome, plantar fasciitis, yes, plantar fasciitis, including flat feet. We've actually at our clinic found some amazing results for flat feet, where people spend ages wearing different contraptions or arches in their foot soles, and yet there is no real change in their flat feet. But just with the simple correction of their vitamin D3 levels, and within a matter of few months, naturally the foot arches are back. That's amazing to look at. Osteoporosis, osteoarthritis, and the list goes on. The metabolic syndrome, fibromyalgia, as I covered, diabetic neuropathies. We are able to manage so many multiple diseases just with correcting vitamin D and its cofactors, or a system called as orthomolecular medicine, which is nothing but fixing the nutritional deficiency for your body. Let's look at this slide, where it tells us about the diseases linked to vitamin D as insufficiency. Now, yes, every organ system of our body is connected in one way or the other for vitamin D, and a deficiency, a long-standing deficiency, does trigger these ailments in the body, right from tuberculosis to upper respiratory tract infections, recurrent allergic rhinitis, to lung disease, hypertension, cardiovascular disease, to type 2 diabetes and metabolic syndrome, muscular aches and pains and weakness, osteoporosis, osteoarthritis. This is just a given, and this slide goes further and further, where it also explains to us how vitamin D as a resistance or a deficiency can cause autoimmune diseases like multiple sclerosis, Crohn's disease, rheumatoid arthritis, psoriasis, and so on. But vitamin D is now also directly linked to cancers, especially breast cancer, colon cancer. And these, again, I would request you to Google about this, go to international journal publications, especially let's say PubMed, and you will be able to find article after article, hundreds of articles, which have tested and validated this claim that vitamin D as a long-standing deficiency is at the root of these cancers, or at least can help avoid the chances of you getting cancer. So should you be supplementing with vitamin D? Yes, absolutely. But let's move on. Why is vitamin D so important for your health? Vitamin D, or cholecalciferol, is also known as the sunshine vitamin. Exposure to sunlight prompts our body's skin cells to start producing it. It's as simple as that. Yes, back in the day when we were much more of an agrarian economy, where we used to go and work on the farms and stuff like that, we used to get 50 to 70% body exposure, and the moment UVB light, which is available only between 11:30 a.m. in the morning to 3 p.m. So yes, it's that bright, hot sun. But when UVB rays touch our skin starts producing vitamin D, or cholecalciferol. And vitamin D, my friends, is actually a secosteroid, a hormone, and a vitamin. So it's literally multidimensional, and it has properties and it has actions. The molecule itself is so dynamic in nature if you really understand the importance of vitamin D. It helps regulate the calcium and the phosphorus homeostasis in the body. This part most of us know, because all of us have been constantly taught about the importance of vitamin D for our bone health. But vitamin D goes way beyond that. In fact, that fact about vitamin D being good for the bones is just 1% of its real role, and how it can actually help turn around your health. We will discover this through the further parts of the presentation. Vitamin D is a master immunomodulator. When I say a master immunomodulator, it literally means that when I say autoimmune diseases or a dysfunction, and immunomodulation is equivalent to vitamin D, and that's why it's an immunomodulator. What immunomodulation means, again, we will understand in the future parts of the presentation. So how does vitamin D get formed? Yes, as I mentioned, when UVB radiation or sunlight touches our skin, from the skin, cholecalciferol gets generated, and then it goes into our liver, and it converts into something what we call as calcidiol, okay, which is also labeled as, if you look at your blood tests, you will see either 25-OHD and you may see 1.25 OHD. So 25 OHD is calcidiol, and 1.25 OHD, which travels from the liver into the kidneys for its final activation, is called calcitriol. Calcitriol is the final activated form of vitamin D in our body. A lot of people who have liver dysfunctions or kidney dysfunctions are not able to convert or synthesize this vitamin D and bring it to its activated form, and that is exactly what we call as a long-standing deficiency or a resistance to vitamin D. Okay, but there are also other genetic polymorphisms which are responsible for what we call as a vitamin D resistance, but we will understand all of this in the future. Now, since all of you know that vitamin D is so important for the bone health, let's quickly look at this particular slide where we know that vitamin D increases the calcium absorption in the gut and encourages new bone formation. Deficiency of vitamin D creates rickets and osteoporosis. If you look at the image of these children and how their legs have become bow feet, so it causes rickets. Now we can see this in the images. And if we are supplemented correctly with vitamin D sufficiently, we prevent the chances of causing rickets or osteoporosis in the long run. But is rickets or is bone health the only potential therapeutic usage of vitamin D? Sorry, my friends, that is just the tip of the iceberg. That is actually the final result of a long-standing D deficiency. But what you may also suffer through your lifetime due to a vitamin D deficiency may also look like allergies of the skin and the respiratory tract, asthma, autism, cancer, cardiovascular disease, chronic pain, colds and flus, diabetes type 1 and type 2, eczema, fetal growth impairment, gestational diabetes, growth and developmental issues, preeclampsia, prenatal infections, and preterm birth. These are all vitamin D deficiency related ailments, but none of us have ever understood this, or none of us have ever been informed about these. So let's go further into what vitamin D can help in. So it can help reduce the risk of flus, it can reduce the risk of cancers, it reduces the chronic muscular aches and pains, reduces the risk of cardiovascular disease, reduces the risk of depression, reduces the risk of developing diabetes, reduces the risk of getting autoimmune disease, and reduces the risk of osteoporosis. So again, I will use a quote here from Dr. Coimbra, who says vitamin D is much more than a hormone, because a hormone has one or two functions. Vitamin D has dozens of functions and is above the category of a hormone because it has the potency, the structure and the power of a hormone, but as it has an incredible diversity of functions for a single substance. So here's an image of a study that is published in the Molecular Aspects of Medicine. This is an international journal which mentions vitamin D deficiency, pandemic and consequences for non-skeletal health, mechanisms of actions. Now what does this really mean? It's actually suggesting that vitamin D has a role way beyond the bones or the non-skeletal health and the mechanism of its actions on other organ systems of our body. This is another journal publication, image of that, which mentions about how vitamin D as a nutrient, hormone and immunomodulator, which is what I mentioned in the earlier part of the presentation, where vitamin D can be used as an immunomodulator. This slide explains to us about the endocrine functions of vitamin D. Now when we say endocrine function, I did mention that vitamin D gets activated first in the liver as calcidiol and then in the kidneys as calcitriol, and from there its actions span across different organ systems of our body. So it works on the parathyroid gland, it works on the bone health, it works on our colon and the gut, it works on the immune system, it is important for the formation of red blood cells, and it also as an immunomodulatory function can inhibit the proliferation of cancer cells. Yes, so these are the endocrine effects of vitamin D. So if you look at this slide, it explains how calcitriol, which is the final activated form of vitamin D, and its power to be able to help modulate or help correct or heal or bring to remission so many different diseases like osteoporosis, cancer, multiple sclerosis, autoimmune diseases, hypertension, heart disease, diabetes, neurological disorders, psoriasis, infections like tuberculosis and leprosy, asthma. So we are now simply discovering the real power of this miracle molecule in the 21st century. Now let's go a little bit more deeper into the subject matter. Now I understand that this may become a little more technical, but stay with me on here. How does vitamin really work? Okay, so there are two types of actions that we say for vitamin D and its activation in the body. Fundamentally, two separate pathways of operation or its action in the body. The first one is what we call as the endocrine action, where let's say someone either gets vitamin D3, cholecalciferol, from sunlight or through oral supplementation or through different foods, and gets synthesized in the liver and then gets further activated from the kidneys and then goes into the intestine and then into the bones. Now this is the traditional pathway that all of us are aware of. This pathway has been utilized by various family practices, the casual supplementation that we get done once a year just to ensure our bone health is okay. This is what is used by orthopedic practitioners or orthopedic surgeons to help heal fractures or bone diseases like osteoarthritis, rheumatoid arthritis. So they use casual supplementation and this particular pathway of the endocrine action of vitamin D. But there is another pathway, a much grander pathway, which is what we call as the local or intracellular activation of vitamin D, which is called as the autocrine and the paracrine action of vitamin D. Now, autocrine action literally means when a hormone is generated by a cell and it influences or immunomodulates or does a specific action on the neighboring cells, that is called the autocrine action of vitamin D or a hormone. A paracrine action literally also means that the cell that helped produce or activate that vitamin D or the hormone, any particular hormone, it also acts on that same cell, and that is the paracrine action. Now I understand that this may be very technical for you to understand, but this is the pathway that we end up using for vitamin D as a therapy, where we are treating a vast and varied type of chronic pain disorders, autoimmune diseases, skin diseases, and this is the pathway that we are fundamentally using, for which we use either at times activated forms of D3 or nanotechnology forms of D3 rather than the simple casual supplementation that you would have done once in a while. So when you do come to us for, let's say, a consultation, or you go to any expert who is practicing the Coimbra protocol, this is what we hear at the clinic every now and then, where a patient walks in and they will say, oh, but I take my vitamin D once in a while. I've taken vitamin D 2 years ago when I'd been to my ortho. And we are like, no, that's just casual supplementation. A therapeutic dose is very different, and we will be using vitamin D at much higher therapeutic dosages to help you bring your disease or the autoimmune dysfunction into remission, as we would actually say. So how does vitamin D work? Now, although this slide may look a lot more technical, let me just try to put this to a little bit of perspective for you, where vitamin D receptors are nuclear receptors in every cell. So yes, each and every cell of our body has a vitamin D receptor, okay? And so when we get the activated form of D3, each and every cell pulls it into its mitochondria and then to the nuclei, and it either gets utilized as an autocrine function or a paracrine function, the way how I explained it to you in the previous slide. Now I understand these things are way too technical, but please stay with us and I'll make it more easier on the way. So in this slide, we will try to understand how vitamin D receptors, where when they receive 1.25 OHD or basically calcitriol, the final activated format of D3, how they work on different systems and what are their different actions. So one of the fundamental actions is what we call as cell proliferation differentiation and apoptosis. Now, apoptosis is a word, please remember this, that this is what exactly happens when a cancer cell is multiplying without apoptosis, or that is exactly what cancer fundamentally is, where a cell starts dividing uncontrollably and it's not reaching what we call as a natural cell death. And vitamin D activated form with the vitamin D receptor available will undertake this particular action. This is an intracellular action, either an autocrine or a paracrine action. It also works as calcium transportation, it works on your skeletal health, it works on your central nervous system, it works on your immune regulation, it works on hormone secretions, it also works on your skin and hair. So let's go a little further. Now these slides are a little more technical, so just have a look at them. I will not try to elaborate too much, but this is for you, anybody who has a scientific bent of mind and can understand this, or if you need to show this to your physician so that they can go through this entire science and help you make this conscious choice of undergoing vitamin D as a therapy. Let's understand the autocrine and paracrine effects of vitamin D. Immune system and modulation, endothelial function, renin-angiotensin system, secretion of insulin, cell differentiation, epigenetic signaling, induction of apoptosis, tumor-induced angiogenesis. Now these are the different autocrine and paracrine functions of vitamin D. So here's a slide which shows again a published case study in an international journal, which fundamentally is telling us that the gene modulatory function of vitamin D helps modulate more than 2000 genes through its nuclear receptors, or VDR as it's called, so vitamin D receptors. Extraskeletal actions of vitamin D beyond the bones. So now my friends, here is where the elephant has entered the building, where we are talking everything about vitamin D beyond simply your bone health. Okay, so local intracellular activation of vitamin D by the enzymes that converts it to the final format of 1,25-OH2D, which is calcitriol. Vitamin D receptor expresses in all cells, basically the immune cells, the macrophages, the monocytes, T cells, B cells, dendritic cells, brain and microglia, lungs, intestine, kidney, heart, prostate, and the gene modulation of more than 2000 plus genes. Isn't this the real miracle molecule that we have all been actually waiting for, or it has all the time been with us, but we somehow lost touch with our own sun? Vitamin D and its actions in cardiovascular health. Now this is a publication that describes about how vitamin D is beneficial in managing cardiovascular health. It actually says that vitamin D deficiency is highly prevalent or present in approximately 30 to 50% of generalized population. A growing body of data suggests that low D3 or 25 hydroxy vitamin D levels may adversely affect your cardiovascular health. Vitamin D also seems to do all the right things for your heart. Vitamin D receptors in the artery walls and the heart muscle lowers the blood pressure via the ACE system, improves the inflammation, it improves insulin sensitivity, reduces inflammation, improves vessel wall recovery to injury. Now we are looking at what we call as the renin-angiotensin system, or RAS. RAS is a complex network that plays a major role in maintaining the blood pressure, fluid and salt balance of the body. The angiotensin 2 is the central biological effector of the RAS and the most potent constrictor of the blood vessels. The angiotensin 2 is inflammatory in nature, and its levels are actually linked to the disease severity. So if you look at this graph, you will understand that angiotensin to renin to ang1, ACE, and then ang2. So with that effect, we also then understand how vitamin D affects cancer cells in a number of ways. So vitamin D switches apoptosis back on, the programmed cell death, as we understand. So if you understand, or if you have experienced anybody suffering cancer in your family, you would be told by your oncologist or your consulting physician that, you know what, cancer is uncontrolled cell growth of a tumor cell fundamentally, and they don't die in time, which is called a cell apoptosis. Now, vitamin D affects cancer cells in a number of ways by switching back this natural apoptosis on. It slows down the multiplication and spread of cancer cells, reduces the growth of new blood vessels to feed the cancer cells and increase the spread of it. Now, isn't this really the miracle molecule, and should you not be consuming vitamin D? Yes, absolutely, but let's stay on. So in this particular slide, we will understand that how vitamin D acts on different polymorphisms and different genetic markers, which in turn influence different types of cancers in our body. Now let's move on to the next part of the presentation, where vitamin D and the nervous system. Now this study actually makes us understand that vitamin D and neurological diseases, endocrine view, and how vitamin D has a direct correlation to the nervous system, and it can help treat disorders of the nervous system. Vitamin D and depression. Vitamin D encourages a good mood. Depression is one of the most prevalent in especially the winter months. Now, is this a coincidence? No, not at all. The moment there is sun which is shining, our moods are automatically alleviated. The moment it's winter and our moods are all automatically mellower. The same thing happens to our own body in the physical aspect, where the moment your D3 levels are below 60, the body considers this as now being winter, and so it feels that it needs to hibernate and it needs to slow down its metabolism and become sluggish. But the moment our D3 levels are above 60, the body considers that now it's spring and summer and everything, the life is going to grow and nurture, and so our moods are automatically better and alleviated. So should you keep your D3 levels above 60? Yes, absolutely. But we will understand this in the dosages and cofactors aspect of this entire presentation. Now, research also indicates that vitamin D supplementation may decrease depressive symptoms during the winter months. Another meta-analysis study suggests that those with the lowest vitamin D levels were 31% more likely to have depression than those with the highest levels. The study also suggests vitamin D and its relation to dementia as a disease, and how it can supplementation or a systematic supplementation of vitamin D can help alleviate symptoms of dementia or better manage the ailment. This slide tells us how unbalanced vitamin D homeostasis can put your body into a negative loop cycle of all these different ailments, where there is a calcium imbalance, there is oxidative stress in the body, which can be experienced as bloating, acidity, muscular aches and pains or soreness, and gut dysbiosis. This is oxidative stress. In India, a lot of you would have been to a lot of Ayurvedic doctors also, and they will say you have a Vata imbalance or a Pitta imbalance, but that fundamentally, my friends, is just oxidative stress. Imbalanced vitamin D homeostasis will also create neurotrophin dysfunctions. It will create mitochondrial dysfunctions, neuronal transmission, protein aggregates. It actually ultimately results into Alzheimer's disease, Parkinson's disease, dementia, neurocognitive diseases, multiple sclerosis, and so many more. But now let's go even further. Autism and its connection to vitamin D. Autism spectrum disorder, or ASD, found to be associated with low vitamin D levels. Yes. So if you have someone who's suffering autism, let's look at their D levels. There is a method where we can really at least help them live a better managed life. I'm not suggesting of anything which is curative, but it's definitely a better lifetime and a lifestyle management for such patients. Vitamin D and eye health. A recent study published in the International Journal of Rheumatic Disease discovered that vitamin D deficiency is strongly associated with dry eye and its severity. Researchers recently hypothesized that vitamin D plays a role in dry eyes due to its anti-inflammatory properties. A study published in April 2011 in the Archives of Ophthalmology found that people who ate more foods with vitamin D or who took vitamin D supplements were less likely to develop age-related macular degeneration. So vision health, yes, again vitamin D it is. Vitamin D and metabolic syndrome. Now pay attention over here, because this is something that most of us actually suffer because of bad food, bad lifestyle, high stress, careers, and lack of sleep, the pollution, and we all suffer something called as the metabolic syndrome. It's also a precursor to type 2 diabetes or all the other lifestyle ailments that we suffer. So there is a direct connection between vitamin D deficiency and the metabolic syndrome. But vitamin D also plays a protective role in type 2 diabetes. Vitamin D exerts various anti-diabetic effects. The VDR is expressed in the pancreatic cells, and calcitriol or 1.25 vitamin D3 stimulates insulin secretion. So if you understand that diabetes is fundamentally at the root of it, clinically, one, it's not an ailment of eating sugar. Please understand this. It's actually an ailment of insulin sensitivity, and when either your insulin secretion slows down or the body is producing a lot more insulin to be able to digest the food that you've just eaten, in which case it actually says that our cells are not sensitive enough to insulin and are not able to take up the food and nutrition into the cell. Okay, vitamin D supplementation improves the insulin sensitivity, and if you are a diabetic and if you are watching this, you need regular supplementation of vitamin D. Improvement in vitamin D status also leads to improvement in insulin sensitivity mediated by upregulation of insulin receptors. Vitamin D modulates inflammation, which is also thought to play a role in type 2 diabetes. Diabetes and vitamin D. Type 1 diabetes results from beta cell destruction. Now vitamin D is an immunosuppressant or an immunosuppressive agent, to be precise. Supplementation with vitamin D reduces the risk of diabetes by about 80% in children. Yes, because type 1 diabetes actually starts quite early on, or it's also called as juvenile diabetes. To avoid type 1 diabetes, regular supplementation even for children is highly recommended, but obviously the dosages are different, it is weight dependent, so there are a lot of factors and you need to consult a professional who is practicing this line of treatment. Vitamin D might protect the pancreas through regular supplementation of the mother, through her diet, or through supplementation. The incidence of type 1 diabetes in children can be reduced considerably. Children who are deficient in vitamin D have 200% increased risk in developing type 1 diabetes. Now, honestly, in our practice, we see this when a lot of children accompany their parents to the clinic, and we are always on the looking for that early telltale signs of insulin resistance. So the pigmentation around the neck region or the pigmentation around their arm folds, creases, we also at times get them checked for their fasting insulin levels, and we find that they are severely deficient of D and in turn have a very high fasting insulin. And the moment we start supplementing them correctly with vitamin D, which is a simple supplementation, it's not even a therapeutic dosage, but a simple supplementation for children at the right age, and within a span of a month or two, and then we go back and again check their fasting insulin, they come back saying they are feeling more healthier, their height got increased, they are feeling fitter and more energetic, and their sugar cravings are gone, they are much more active in their class, they can focus again, the pigmentation on the skin is disappeared, they've started losing that excess phlegm and fat from the body, and we are actually interested in the numbers, and we see the fasting insulin coming back down to the normal levels of below 4 at times, which is what it should be at that age. So taking care of children also and supplementing them regularly with the right, not only vitamin D alone, but also its cofactors, is actually very essential to take care of their health well in advance. Now, this particular slide, although it's quite extensive, let me just simply put this, that if you have been trying to lose that weight and you've been doing that yoga and pranayam and workouts and different diets and fasting, water fasting, intermittent fasting and whatnot, all I can tell you is look into your vitamin D levels, but also look at the inverse correlation of your PTH, because vitamin D reception activation is much slower when someone is already obese, and so they need much higher doses. Now, why am I saying this? That obesity and vitamin D are directly inversely related? Here's how. Let me give you a simple theory. Our mind, or the reptilian brain, the moment there is sunlight or when it is summer or spring, it knows that there is no real threat and there is going to be food available all throughout nature. Okay? And it can move around freely. And so it need not hoard anything. Storing fat in the body is also a deep-seated reptilian brain mechanism of hoarding on, because it feels that probably it may not get any food or nutrition for a long duration, which is during the months of winter, when most of the animal kingdom goes into hibernation. And so it slows down its metabolism, it hoards a lot of food and is not ready to let go of that extra fat, because fat is the body's mechanism of the ultimate survival go-to mechanism. Okay, so if you are on that journey of trying to lose weight and be healthy and have a lean mean body, look into vitamin D as a therapy or as a supplementation modality. Without correcting that, all your efforts in general, this is our observation, are always circular in nature, and people keep going back in circles, and actually they damage their body much further in that exercise of trying to lose that excess weight. Vitamin D and its connection to hypothyroidism. Now, this study actually suggests that right supplementation at therapeutic dosages at times, or even simple supplementary dosages, has helped reduce or reduction in TSH and autoantibodies with vitamin D correction. So vitamin D deficiency is specifically associated with autoimmune thyroid disease, Graves' disease and Hashimoto's disease. Now, at the clinic, we find and we manage hundreds of patients with Hashimoto's thyroiditis, and with vitamin D as a therapy, the management is actually so much better. PCOD or PCOS and PCOD, a direct correlation with vitamin D. Association of low levels of vitamin D and insulin resistance. Again, a study published. Association of low level of vitamin D and obesity. Correlation between vitamin D and SHGB. Correlation between vitamin D and FAI. Vitamin D supplementation improves menstrual frequency. Yes, and it also improves all the metabolic parameters. So vitamin D and PCOS, PCOD have a direct correlation. Vitamin D also helps in reducing the risk of a lot of maternal complications, especially during the times of pregnancies. So keeping vitamin D levels for women above 40 to 60 ng/mol for pregnant women have shown that 60% lower risk of preterm birth, and also abortions or abnormalities, or gestational diabetes and so many other complications that women go through during their preterm and during post-delivery. Now, this particular slide, we will discuss how vitamin D levels above 40 ng/mol during conception, pregnancy and later help the mother and the baby. So it tells us that it's now validated that 60% lower risk of preterm and pre-eclampsia, lower the risk of gestational diabetes, lower risk of postpartum depression, 70% lower prevalence of common cold, reduction in adult type 1 diabetes, better immune system development of the infants, reduction in eczema, allergies, asthma for the infant. Also, I'll just add over here, we see hundreds of psoriasis patients, and when we are doing the history taking, we always find that it's generally the women who suffer psoriasis a lot more than men. Not that men don't, but in women, through their term of pregnancy, one, they've never been supplemented correctly with vitamin D. On top of that, their entire immune system, to hold a full term pregnancy, their immune system automatically is suppressed for all the natural and good reasons, right reasons. But post delivery, the D levels are so low, and that is exactly where they get an autoimmune trigger externally or internally, and that is exactly when they start developing psoriasis as an ailment. And this is what we generally find in so many history taking cases, and in which case it does definitely suggest that at least post pregnancy women should be sufficiently supplemented with the right supplementary dosages of vitamin D to avoid those post delivery depression or skin diseases and so many other complications that they suffer. Now, gut health and vitamin D. Now, when I say gut health and vitamin D, gut health is now very in topic as of today on the internet, where you will see hundreds of reels and hundreds of nutritionists talking about the gut health and using different herbs or formulations to improve your digestive function. Or there is something called as the leaky gut syndrome, which one of the first effects that you see is chronic bloating, gassiness, aches and pains, and acidity, constipation, and this directly reveal the health of your gut. Now, when we say gut permeability, these toxins or these microbes can pass through your gut wall, and vitamin D and their receptors in the lining of the gut that communicate with the tight junctions actually help stitch the gut cells together. So if you're actually wanting to reset your gut, you're wanting to correct your digestive function, you're wanting to get rid of that chronic bloating, acidity, gassiness, and that distension in the stomach every time you eat and you feel a little pukey, look into vitamin D correctly again, because gut health is directly governed by vitamin D. Gut health and immune system are absolutely extremely interlinked, and vitamin D, and also there is another vitamin which I will introduce in the future slides called vitamin B1, together help stitch or help improve the gut permeability as it's called. And vitamin D is one of many factors that help keep the microbiome healthy in our gut. So yes, vitamin D in the colon is also anti-inflammatory, and we use this again to help manage diverticulitis, ulcerative colitis way better. Obviously, we also use it for relieving the gut inflammation, the chronic ache, the chronic bloating and gassiness and whatnot. Now let's look at this particular image where vitamin D 2020 and beyond, so post COVID. Now, just out of experience, prior to COVID, we were seeing people, probably 2 or 3 people would end up having an autoimmune disease out of 50 people that we would see. But suddenly after COVID, because we stayed indoors for not only the first 3 months, but so much more, because now it's work from home, or that that hybrid model where we've just actually stopped penetrating out into the sun, and suddenly we are seeing a surge of autoimmune diseases getting triggered in so many more people. Now, when I personally look at the real numbers of things, as I mentioned, that we would see 2 or 3 people out of 50 people with an autoimmune disease. Of late, we see as high as 25 to 30 people out of 50 people having some sort of autoimmune disease or on their way to developing an autoimmune disease. Okay, so let's look at how vitamin D can help you manage your health so much better. So my question to you is, are you getting enough? And that we will cover in the next part of this presentation about the dosages and the overall deficiency. How deficient are we, and how to calculate your dosages. So I will leave you all with this, and I will see you in the next part.